But then the first question, why I know like this is, the conversation here has been about data and analytics and what's not, right? The first thing, the first question is, why is data even important in healthcare to start with? Beyond the broader conversation and context around data analytics, AI is eating the world, data being the new meat thing. Why had fundamental basis? Why is data very important in healthcare? And the reason is very simple. Healthcare sector as a whole is a data-driven one that is founded on empirical evidence. And that means if you look at every aspect of the healthcare sector, say a practicing medical doctor, a pharmacist, a med lab scientist, or a nurse, or a psychologist, you have, whatever role you currently play in that field, right? At the core of it is, that empirical evidence that is data-driven and data-backed. And what do I mean by this, right? So if let's pick three random parts of like the healthcare practice, right? So medical diagnosis. How did physicians learn to identify disease, right? Say, oh, when someone is sneezing and the person is having headache and the person is doing this, then it must be this condition, right? Or how did they come to learn about like treatment plans? Say, oh, this person has an infection, right? There are different types of infection. How do you know whether to give this person amoxicillin or give this person ceftriaxone or give that other person ciprofloxacin, right? How do you even know that, oh, this compound on like a fundamental basis is going to be active against this microorganism, right? Why? All of them at the core of it, they are based on empirical evidence that is backed by data. That means they have done a lot of research, a lot of work, right, to gather that data, right, and be able to justify at every point in time that based on this data that we've collected over these many years from this large population that covers this large sample that covers a broader aspect of the population, I can tell you categorically that, oh, when someone is complaining about all these kind of conditions, right, that means that person has, this is the medical diagnosis. Or when someone comes with this medical diagnosis, this is like the precise treatment plan, or of all the different compounds that exist, right? If you take this particular compound, say this acetylsalicylic, whenever you're feeling pain, you can be able to use it, and you can be able to, you can be guaranteed that the pain will subside, right? This is just, to ground the whole conversation that at its very core, right, medicine or healthcare as a field is what it is because of the data that backs it and that guides the conversation, right? And this is why, when you have conversations with some people that tell you, oh, something, or maybe this vaccine, why are they even giving us vaccine, right? They're just trying to kill us, right? And the evidence is that before these vaccines or any of these things are brought to market, they've done extensive study, collected extensive data, and provided that data to an unbiased third party, call it the regulator, FDA, NAFDAC, and whatnot. And upon looking at that data, they can then tell you this is good for people, this is not good for people. Why? All of it is backed by data. But I know like this conversation is not about like the nitty-gritty of how data makes up healthcare. So now to like the broader conversation, how is data and AI now transforming the healthcare space? So I'll be talking from three different vantage points, right? Which is first, patient care. The other part is ease of life of medical professionals. And then the last one is healthcare business operations, business optimization. And I'll try it as much as possible to give us, examples of how that is being done, right? So for the first one, patient care, right? How are we using data and how are we using AI to improve patient care? And the first example that looks all of us in the eye is wearables and medical devices. So there was one time I was working with one startup, and what we were trying to do is very simple. For people that have diabetes and hypertension, it's a data problem, right? Your blood pressure is above this particular value, or your blood sugar is above this particular value. And so, there are whole different empirical evidence of how you can try to treat them, they're like, you can use drugs, they're non-pharmacological therapies. And so we're trying to like, deal with non-pharmacological therapies and transmit it digital therapeutics, right? How do we quantify a physical workout that you're able to, generate or use enough calorie to keep your blood sugar level, right? How do you quantify how much food you should eat, how much exercise you should do, and what's not, right? And this tells us, how you are using the data, right? The benefit of those things is you can now collate all those things over a long period of time, and then you can be able to show this person that, oh, if you eat this, portion, small portion, over time. For a start, you might be hungry, but as you go on, your body gets used to it. But then the effects you're seeing, I mean, this is how it directly affects your blood pressure or your blood sugar, right? And that shows how we're using, and this even is now just digital therapeutics. Now imagine people, now we have, Fitbits, we have Apple Watch, we have Oraimo Watch, right? We are capable on the fly of measuring your blood pressure, your blood sugar, your blood oxygen saturation level, and so many other important information. And with all this information, right, we are able to like make better holistic decisions about our health. There was the case I came across maybe on Twitter where someone was sharing how their Apple Watch was able to detect that, oh, I think maybe grandma somewhere who is about to have like an heart attack, right? Just before it happened. Why? Because it was able to measure, like the heart rhythm, and it was like able to figure out that, oh, this person is about to have an heart attack. And then you alerted the doctors, right? And this shows, next gen, how we are currently using data and how we're using AI, to experience patient care. That means you don't have to wait for these things to happen before you then start looking for treatment. You can be proactive, right? You can be proactive, measure on the fly, and detect even before things happen, right? Because now we're able to collate all this important data that is necessary for your doctor, for your nurses, for your pharmacists, physiotherapists to make holistic decision about your health. But then the other example is electronic health record, right? And so how does electronic health record improve patient care? Let me give you an example, right? So most hospitals that you go to, they use like paper, they move paper around. That's how when you get to the hospital, you file for your card, you bring out staff big folder, then they fill some things there, they carry it to the doctor writes their prescriptions and whatnot on the paper, and it's the paper that is being moved around. But then what is the challenge? The challenge is you need to come back to that particular same hospital for that information, I mean, for you to have a continuous care, right? That means if you go to another hospital, the best experience is they have to like start from the scratch, right? Create the record from scratch. They do not have information about previous things that they treated you on. And let me give you an example, right? Say for someone that has sensitivity, one very popular one is sulfur sensitivity. That means they can use drugs that contain sulfur derivatives. So say aspirin, Septrin, and whatnot. They can't. But then the previous hospital sort of like figure out and they documented that in the person's record. Then say emergency, this person cannot talk, he can't take all the important, you can't click the person properly. So this person needs an emergency response. And like usually like the first response is to give this person this particular drug. But then because you have to like start that process again, say they give this person Septrin or aspirin. This is an hypothetical case. And then, although the person had a condition that you're trying to treat initially, the person then develops, anaphylactic reaction to that drug that the person is not supposed to use. Why? Because there's no connection. The data does not move seamlessly. And this is what electronic health record is doing now, right? Where you can seamlessly transfer your medical data, your medical information from one institution to another. But even not just from one institution to another, within the same hospital, right? I've been in hospitals where your folder ends majorly with say maybe like the doctor and the nurses that are taking care of you, right? So from other people, cannot see your whole file to make an holistic decision about what the best care for you should be, right? And these are things that electronic health records now try to source. Now, on the fly with their PC, everybody can see that data, and then they can be able to make holistic decision about your healthcare. And this is, how data and AI is leveraging this. Although at the fundamental, this is just data, like moving data from one point to the other. But even it shows that without even adding an extra layer of AI or any sort of intelligence, having that data at the fundamental level is very important and plays a huge role in helping you, have care. The other part is ease of life for healthcare professionals, right? How are we using AI? How are we using data to improve the life of healthcare professionals? And you might be like, why should I care about life quality of the healthcare professional? They're being paid to do their job, right? And now to give you a context, right? In Nigeria, so WHO standard for doctor to patient ratio should be 1 to 500, right? For every 500 person, there should be at least one doctor today. That's like the ratio. In Nigeria, we used to have 1 to 6,000 before you Japari, right? 1 to 6,000. And now a lot of our doctors are now finding, before they leave medical school, right? They're looking for a way out, right? Go to UK, go to Australia, go to Canada or US. And this is just for doctors, right? The case for nurses is even, getting more acute, right? Pharmacists, physiotherapists, and what's not. That means there is a whole lot more that you need all these few healthcare professionals to do, right? And this is how it now impacts your life as a patient. One time, my mom needed to see the cardiologist in an hospital here, right? And she was like, oh, she has to go to the hospital by 6 a.m. I was like, why are you going to the hospital by 6 a.m.? They will not open until like maybe 8 or 9. She was like, see, she has gone to accident. That's how they do, right? And interestingly, this day, my mom went by 6 a.m. I was still sleeping. She went by 6 a.m. She was waiting to see that, before they come, blah, blah, blah. When they came around it, so, as you get there, you sort of like queue up or take a number. So when they got there and they took their info, she was number, I can't remember the number, but they were like, they cannot see her again because they've taken the specific number of people that they need to see. And I was like, how is that possible? Like, well, that is how they do it. I was like, it doesn't make sense. One way or the other, they later admitted that, one more person, for all your struggle, what's not. You will not believe that the doctor did not attend to my mom until like almost 6 p.m. in the evening. She has been there since like 6 a.m. They couldn't attend to her. And that shows that there's a lot of work that this small pool of people now have to do, right? And that means if there's that much pressure on them, the goal is I need to attend to all these people. And they might not be able to like pay enough attention to you. And that is why, we need to like think about how do we then reduce this much pressure and this much workload that are on these people, right? And this is why, some startups have been looking into it. Two interesting companies that are doing something around this is Intron Health, right? So when you get to the hospital, I've worked in the hospital, I work in the hospital. Interestingly, one of like the things that doctors and pharmacists and healthcare professionals spend their time on most times is not even talking to patients or attending to patients. Is paperwork. Now you've been talking to these patients. You need to be taking note of all the things that this patient is saying, right? They are thinking in your head what is like the diagnosis. You need to be documenting, how you're arriving at the diagnosis. You're saying, okay, maybe we should start you with this treatment. You need to document that this is treatment, everything, right? So there's a lot of documentation that they need to do that is taking a very significant portion of their time, right? And so this company, Intron Health, they developed an AI solution is based on Whisper, a speech to text tool that was released by OpenAI, and then the function is for medical setting and on African cases, right? So they operate majorly in Africa. The idea is, how do we then, reduce the time that doctors spend doing the documentation? And they, released their tool, right? And with this tool, it has been able to significantly reduce the workload that these doctors have to do, right? And this now means they have more time to concentrate and attend to patients and think about whatever it is the challenges. Another company that is doing something interesting is Meuve Health in Ghana, right? There was this seminar I attended one time when we was talking about how they were building an artificial general intelligence, right? What their AI assistant do is majorly it assists the doctor in making diagnosis, right? I think they have an excellent tool around radiology. So say you come with an X-ray, while the doctor, is having to do the mental work, right? You then have an AI assistant that you can bounce off idea with, right? That, oh, what do you think is the diagnosis for the AI? Then you can say, oh, but then look at this particular dot, look at this piece. Don't you think that, something that makes their life easy, that reduce a lot of cognitive power and help them, with their work, right? So this is another example of how AI and data is helping improving ease of life for healthcare professionals. The last thing that I'll be talking about, I think I have about 10 minutes or so left, is healthcare business process optimization. And this is very important, right? While we've talked about the patients, we've talked about the professional. Now the process as a whole, how do we optimize it? So last year I worked on a project for some people, right? Majorly around pharmaceuticals. Okay, so they said I have 7 minutes. Pharmaceuticals for forecasting. Between last year and this year, in the survey that I did, the pharmacy where I was working, right? We checked how has inflation affected drugs, right? And a lot of drugs, the prices have increased by 150%, some 200%, some 300%, right? Augmentin, as of last year, the Augmentin specific brand was maybe 5K, 7K. As of maybe sometime last month when I was in, when I saw a friend, because we don't even have that specific brand again in my pharmacy, right? That specific brand was 23,000 or so, right? And so we were what if we can develop a tool that can help the pharmacy, estimate how much drug they need for this particular time frame. And then they can order this such that at no point will they run out of drugs, right? Because what we experienced a lot this year was there were so many drugs that we ran out of, right? And we couldn't restock again. Why? Because for some reason it is no longer available in the country, or it's just one way or the other, right? Something happened, right? So what if we can estimate, say, for the next 3 months, next 6 months, this exact quantity of medication using AI, and then we can, restock it, right? And so there are also some companies that are building interesting solutions around it. There's drug stock, majorly that help with supply chain management, but shelf life also that does something around it. But then the other part is, how do we optimize facilities that we use? So Emergency Response Africa, what they do is they provide ambulatory services, right? So there's an emergency, we need to move a patient, right? But then the other question is, if I'm moving a patient, where are we moving that patient to? Right? Which hospital particularly are we moving them to? And for them to have a very effective or efficient system, they need to be able to, know, so for these particular hospitals around, what is the closest hospital? Do they have beds? Do they have facility for this particular emergency, right? Imagine they take a patient to an hospital and that place is filled up already, and then they have to move that person to another place, right? So how then can we optimize, facilities around us for emergency cases, right? There's also these patient booking optimization by Northcare, right? What they are trying to do. So most times when you go to the hospital, a lot of people complain that they spend too much time waiting to see the doctor. Why? I mean, like I said, we have very small number of doctors to attend to you. But what if we can, evenly optimize, right? Say, this is when there's going to be so much so load of work or whatnot. So what if we are able to like evenly spread out these patients such that you are going to the hospital exactly at when the doctor will be able to have time for you, right? So all these, are just like illustrations of how we are currently using AI and data majorly in the healthcare. But then the conclusion is there's still so much that can be done using data and AI in the healthcare. And we are banking on you and I to build the solutions we need because I mean if we don't build it, nobody else will. Thank you very much.
Oh, thank you very much. Thank you very much. That was a very mind-blowing one. Mr. Jala, thank you very much. I hope that we've been able to see, once again, this re-emphasizes the fact that as a data analyst or a data scientist, you are not just there to boast, you are there to solve problems. You are there to use your skills to go into the industry and solve problems. Mr. Jala was talking about how that this digital wristwatch saved somebody like because it could predict, it could tell that this person is going to have an heart attack. So this is wonderful. So if you're seeing this and you're aspiring to be a data analyst, what we're trying to do is that we're reorientating your mind, taking you away from you coming to know or have a new skill to the fact that you're a problem solver. You are the lifeline of every business. You are the one that people are waiting for. You are the hope of every business. And you are the hope that every business will either make it or fail in life. All right, so we're just going to take two questions. One minute. Thank you. All right, so whoever asked should just raise his hand. You have a question? Okay, Ronke, just take over the question aspect. Over to you.
Okay.
Ronke, are you there? Yeah.
Thank you so much for that. Please, if you have any question, we just have like 2 minutes to see if there's anybody that has any question, so that we can have the speakers, because we are actually out of time. So anyone, okay, 2 minutes. Okay. So before, let me just recap before we have the last speaker, since we don't have any question. If you enjoy any section, of course I know that we enjoy every section, right? But like if there is anyone that's talked to you personally, please just make a screenshot. Remember that if you want to make a post, you need a screenshot, since it's a virtual